Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So in today's session, I'm going to review radiology section procedure and I'm going to brief about the important procedure which comes under your radiology CPT section. Since radiology will also contribute 6 marks for your CPC exam, and also we do have radiology coding. Okay, we will be having a separate projects for radiology coding. So if you are good at radiology section, you can get place in radiology coding as well. Okay. So and as we know, like most of us, we will be or we have heard about the terms like CT scan or MRI, X-ray, ultrasound. All of these techniques or the name we have heard, but most of us, we don't exactly know how do they perform or on what basis that the radiologist will order such techniques. Okay, so they'll be choosing, the doctor will choose one over other, right? For few condition they'll order CT scan, and for few they'll order MRI, and for few they order ultrasound. Okay, so we have to know or we have to understand how this technique or this procedure modality works. Okay, what is the specification or what is the procedure identification. Okay, everything we need to understand in today's session. Okay, that's why I have taken all the radiologic basic procedure terminologies, and I'm going to explain what it is and why do they perform. Okay, and how do they perform, everything I'll explain. And also I will give the brief introduction about the important procedure, and I'll also share the tips and few tricks on radiology coding. Okay, so please do watch this video till end, and if you find it insightful or useful, please do subscribe to my channel, and please do share with your medical coding friends. Okay, so let's start with the session. So firstly, when you take radiology as your section for the study purpose, so first thing you need to understand is about modifiers. Okay, so modifiers include 26. Okay, 26 modifier, which is very common under radiology section. So 26 will be used for professional service. Okay, when the questioner asks for the provider service, like how do you bill for provider, so if you find out is a profi physician involved and he has given his service professionally, then you should bill 26 to make him get paid. Okay, with the respective CPT code. And same way, TC. TC is for technical component, and if they have taken a support technically, then you should use TC modifier with a particular X-ray CPT code. And then coming to laterality modifiers, LT and RT, so left side and right side. So when we have a bilateral sections, so say for example you have right hand and left hand, so in this case you can utilize LT and RT. Same way you have right ear left ear, then also you will think of laterality modifier. But when they are examining chest, okay, it's a single or any single organ. Okay, with it they don't have any like modalities or the specificity of right side and left side. Okay, then you don't have the two things, and you cannot just go and select RT and LT if you just mention right side of the organ, left side of the organ. Okay, so if they are mentioning bladder or uterus, okay, for bladder, left side of the bladder is examined, so you cannot give LT modifier for that. But if I mention left side of the hand, left hand, okay, left hand is examined, or take an X-ray on right hand, left leg, right leg. In this case, you can give RT and LT modifier according to the laterality. And then F series modifier is for finger X-ray, and T series modifier is for toe X-ray. Okay, so all of these modifier importance you should know. And 50, it is for bilateral procedures, and 52 is for reduced service. So all of these are very few important modifiers which respect to radiology section is very important. Okay, so next, coming back to the procedures, the first, as I said, you just have to make a section by section for study. First, you can take diagnostic radiology and understand what is diagnostic imaging. Okay, and what are the different procedure you will get under diagnostic radiology. Okay, so as I said, you will be getting 6 marks, and with this 6 marks, most of the questions will be combined with the other procedure, other surgery series procedure. Okay, you may have to check the digestive, or you may have to check the cardiovascular. So there will always be a combined procedures. Okay, so that's why it is, because radiology we will be using with all the other section as well. So you have to highlight whenever you are seeing radiology code is needed with any other surgery procedure. You just make a note or highlight. Okay, so when you are referring or when you are revising, it will add on. Okay, and so coming back to diagnostic radiology, so diagnostic radiology is like examination of body structure with the radiologic methods. So they can use x-ray or MRI. Okay, so they'll use and here what is the thing, you have to check where they are performing the x-ray. Okay, the anatomical site plays a very important role. And with the anatomical site, you should also check the views, how many views they have taken. Okay, two view x-ray, one view x-ray, or laterals x-ray, x-ray. And they'll mention how many views they have took, they'll give. So radiology codes also will vary on the views. Okay, that is important. And one more thing under diagnostic is it is regarding contrast material. Okay, so before that, I'll tell you what is X-ray and what is MRI. So let's see all those. So if you can see what is X-ray. So X-ray is a common imaging technique using radiation to view bones internal structure. Okay, so it's a X-ray is a most common and oldest imaging technique. Okay, so here what they'll do, they'll use a small amount of radiation to produce image of bones and certain internal structures. Okay, so that is the purpose of X-ray. And coming to CT scan, so computed tomography, here it's an advanced imaging technique using X-ray beam to create a cross-sectional image of the body. Okay, so this is if you see the procedure, it requires or it takes create like cross-sectional image it will take. Okay, so if it is a cross-sectional image is needed for the provider for evaluation, he will prescribe or he will order. Okay, he will order, you have to take a CT scan. Okay, so it's like supercharged X-ray we say. Okay, and instead of just one image, it can take, CT can take multiple cross-sectional images. Next is MRI, so magnetic resonance imaging. So this is a technique that uses a magnetic field and radio waves to create a detailed image of the organ and tissue. Okay, so unlike X-ray, MRI use a magnetic field and radio waves. Okay, but there is no radiation here. Here they are only using magnetic field and radio waves. Okay, and also what to say, it's especially good for the soft tissue like brain, spinal cord, muscle and joint. Okay, so most of the time, if you remember, if the patient have anything related to brain, they will order MRI, not CT. Okay, they'll order, you have to take MRI. So it will help to take a detailed images of the particular organ. Okay, and if it is a soft tissue, so MRI will be good for that. Next is ultrasound. So ultrasound is a diagnostic imaging method using the sound waves to visualize soft tissue, often used in pregnancy and other evaluation. Okay, so ultrasound, if you can see, it's a sound wave based technique, and it is completely safe. Okay, it is completely safe and radiation free. So it is widely used in pregnancy to check the fetal development, or maternal evaluation, fetal heart rate, okay, anatomical view of the baby. So for everything they'll use ultrasound. For ultrasound they'll use for both obstetric and non-obstetric. Okay, so it depends on what they need. Next is mammography. Mammography is a specialized X-ray and it is specially designed for breast to detect the abnormalities, including cancer. Okay, so if the patient wants to get breast cancer screening, then they go for mammography. So here in mammography, for CPT coding, we do have two sets of code. One is diagnostic mammography and one is screening mammography. So under screening mammography, you will be having a single code with a bilateral breast. Okay, because the patient is going for screening, then they have to screen both the breast. Okay, so we do have only one code. And diagnostic mammography here based on abnormality. Okay, if she is suffering from a lump in the right breast or lump in the left breast, they are going to screen a unilateral breast or sometimes bilateral breast. So we do have codes for both unilateral and bilateral for diagnostic mammography. Okay, so that is also important. Next, fluoroscopy. So here, fluoroscopy is a technique, imaging technique, uses X-ray to observe the movement within the body, often used for a guided procedure. Okay, guided procedure is very important. So if you just check the radiology, or sorry, surgical procedures. Say for example, with a FNA biopsy, fine needle aspiration biopsy, they will be utilizing the fluoroscopy guidance. Okay, guided procedure. It's a combination. To perform one surgical procedure, they need one more imaging guidance. Okay, so that is we need to check in the main procedure CPT code itself has a guidance included or not included. Sometimes guidance will not be included. So in the parenthetical note, you can see that if imaging guidance is used, report the radiology section. Okay, whatever the guidance they'll use, according to that guidance code, we have to code it additional. Okay, so that is regarding guided procedure. Next is angiography. It's a diagnostic test that uses a contrast dye and X-ray to examine blood vessel for blockages of abnormalities. Okay, so here they are using contrast dye. Okay, contrast dye can be injected or maybe they can swallow through orally. Okay, just that contrast material increase the opacity and it will help to diagnose or to visualize the abnormality very clearly. Okay, so angiography is to examine the blood vessel for the blockages or abnormality that can be found in blood vessels. So next is nuclear medicine scan. So nuclear medicine is a technique using radioactive tracer to assess an organ function. Okay, so the common nuclear medicine techniques are PET scan, for cancer detection. So I'll explain the PET later. So next is DEXA. So dual energy X-ray. The bone density can use to diagnose the osteoporosis by measuring calcium level in the bone. So under DEXA, we can see like vertebral fracture assessment or spinal fracture assessment, bone density study, age study, everything will come under, bone and joint studies. Next is interventional radiology. So here, this is a fascinating branch. Okay, so where diagnosis and treatment happens together. So doctor use image to guide, like they'll use the guide tool inside the body, like placing stents, okay, and or draining abscess, or even performing the biopsies. So all through small cuts. Okay, so that's why it's a branch of radiology performing minimally invasive procedure guided by imaging such as biopsies and stent placement. So if you have heard IVR, okay, IVR this specialty is having really good scope. Okay, so if anyone is working in IVR, they'll be knowing about this. But in future, just know that you in medical coding we do have IVR specialty coding. So next is contrast studies. So as I already mentioned, what is contrast material? So it's an imaging test using contrast agents to enhance the visibility of internal structure. So while utilizing CT or MRI scan, they'll inject the contrast dye to increase the visibility of the internal organ. So next is echocardiography. So it's a specialized ultrasound imaging technique used to evaluate heart function and structure. So next, PET scan. So PET stands for positron emission tomography. So this PET scan belongs to nuclear medicine. Okay, just a minute. So PET scan is a nuclear medicine imaging test that detects the metabolic activity often used in cancer and brain disorder diagnosis. Okay. Next is SPECT. So SPECT actually in 2023 CPC exam they questioned about what is SPECT. SPECT stands for. Okay. So SPECT stands for single photon emission computed tomography, and they use it's a nuclear imaging technique providing 3D images of internal organ to detect the diseases like heart disorder and tumors. So this will give you a 3D images of the organ. Next, venography. So again it's a diagnostic x-ray test that examine the veins after injecting the contrast dye to detect the condition like deep vein thrombosis. And so next you have barium swallow. So like utilizing any imaging technique, they'll swallow this barium. Okay, so to enhance the visibility of and to examine the bowel conditions. Okay, like anything related to esophagus or swallowing disorders. Okay, for that they'll use this barium and barium enema. Arthrogram. So it's a joint imaging technique using contrast dye and MRI or CT to diagnose the joint abnormalities. Next is Doppler ultrasound. So it's a specialized or advanced ultrasound assessing blood flow in veins and arteries, commonly used to detect the blood clots or blockages. So duplex Doppler, you might have heard these terms. Next is myelography. So myelography is a contrast enhanced X-ray technique to evaluate the spinal cord, nerve root, and abnormalities. Next is hysterospalingography. So this is a fluoroscopic guided procedure using contrast dye to examine the uterus and fallopian tubes for blockages or abnormalities. Okay, so to examine uterus and fallopian tube, they'll be ordering this particular technique. Okay, so these are few common basic terminologies, I mean procedure terminologies or techniques that you could see in the radiology procedures. Okay, so now coming back to the index. So if you see here, so if you see here, under diagnostic radiology, as I mentioned, we will be having X-ray. Okay, with respect to anatomical site, you need to check how many views they have taken. Say, for example, if they order chest X-ray, you need to check how many views they have shared. Like they have took one view chest X-ray or two views chest X-ray. So likewise, you have to check. And apart from that, for both CT and MRI, so we were already spoke about contrast material. Okay, so in this diagnostic radiology, we will be able to see three sets of codes with respect to anatomical site and a particular technique. Okay, say for example, CT on abdomen. Okay, CT performing on abdomen. So here the concept is whether they are using contrast material, that is with contrast material, without contrast material, or with followed by without contrast followed by with contrast material. Okay, three codes will be there, three different procedures. Okay, single anatomical site, but the procedure modality is CT on abdomen with contrast. That means they are using contrast material. Next is without contrast. That means they are not at all using contrast material. Next is without followed by with. That means they started taking an CT scan without inserting or injecting the contrast material. But further section, once they understood they need contrast material, they have immediately inserted the contrast material for the further sections. Okay, so that is without followed by with contrast. So for all the three locations with respect to CT and MRI, you have to check whether they have used contrast material, not used contrast material, and without followed by with contrast. So these keywords you need to check and you have to take the code. And one more important coding tip here is when they specify contrast material being injected or inserted through orally or rectally. Okay, both are natural openings. So if they just give contrast material to swallow or to consume, okay, through orally, or if they're injecting through rectal, then we should always consider to go with without contrast material. So you just select the code saying without contrast material. Okay, so all of this concept in detail I'll explain in the class, my classes. So if you want, you can enroll to classes. And then coming to diagnostic ultrasound, here also you have all the anatomical sites. Okay, ultrasound on head, neck, chest, abdomen, and retroperitoneum. Okay, ultrasound complete examination or ultrasound limited examination you have to check, and you have to assign the code accordingly. And then coming to see under ultrasound, you can also see obstacle and non-obstacle. These two, in that obstacle is very important. Okay, so here pregnant woman will be coming for uterus and maternal evaluation, and you need to check the gestational week and how many fetus she carries. Single fetus means single primary code. If she carries twins, then you need to utilize a corresponding add-on code to code for an additional fetus. Okay, so this is very important concept. And again, we have nuchal translucency, and we have total limited study, follow-up study. So just navigate this obstacle. It is very important concept. And coming to radiologic guidance, so all of these guidance we will be using fluoroscopic guidance, CT guidance, and MRI guidance. Okay, if you take an example of maybe orthosynthesis, okay, orthosynthesis performed on major joint using fluoroscopic guidance, minor joint or small joints using MRI guidance. So the thing here is whenever you are coding for a guided procedure, make sure the primary procedure it include guidance in it or not. If it is already guidance is included, you don't have to code this radiology code separately. But the surgical procedure did not include guidance, and for guidance we have to additionally code. Then following the parenthetical note, whatever the guidance they'll use, you can code it. Okay. Next, breast mammography, I've already explained. It is related to breast cancer screening. If it is only screening, then we have a single code. Diagnostic mammography means we have to check whether they are doing unilaterally or bilaterally. Accordingly, you can select the breast mammography code. Bone and joint studies, here we will be having, osseo survey, osseo survey on infant, okay, limited study, bone age study, all those comes here. Bone and joint study. This is important. Next is radiation oncology. So as you all know, so what they do in radiation oncology, they'll use high dose of radiation of various sources, okay, to treat the cancer. Right, they'll be using SRS, stereotactic radiosurgery. In that SRS or simulation method, simple simulation or intermediate simulation. Okay, so treatment delivery, all of these things you can just see. Clinical brachytherapy, radiation treatment delivery, neuron beam treatment delivery. So all of these things you have to just go through. But in the radiation oncology, the important thing is SRS and clinical brachytherapy. Okay. So last is nuclear medicine. So nuclear medicine means they'll use the radioactive substance and they'll introduce these radioactive elements to the body to locate and diagnose, okay, to locate and diagnose the disease. So they can insert this radioactive element for endocrine system to check the endocrine system functionality. Okay, same way cardiovascular, respiratory. Okay, all of these things, they it will under nuclear medicine you will be able to see. So SPECT, okay, SPECT technique, and if you take cardiovascular system here, what to say, perfusion technologies or perfusion technique. Okay, so I'll just show. And see cardiovascular system. So under cardiovascular system, myocardial perfusion imaging tomography utilizing SPECT, single study at stress, multiple studies at stress. Okay, so all of this single study are they doing, multiple study, or what kind of technique they are using, PET or SPECT, or maybe gated equilibrium, first pass technique, okay, or planner. All of this thing we need to check. Okay, so same goes with the other system also under nuclear medicine. Say for example, if you want nervous system, okay, so here is a respiratory, genitourinary, nervous system. So in previous video I already explained current year CPC exam, they questioned about brain imaging. Okay, brain imaging exact 4 static views. The question is about brain, 4 static views they have taken. So for 4 static views, you have to code 78605. Okay, minimum of 4 static views. 78600 is less than 4 static views. Okay, if you get 3, 2, 1, you can code 78600. If you get 4 or more, you can code 78605. Okay, so that's how it varies on the system under nuclear medicine. Okay, just know what is SPECT and gated equilibrium, cardiac pool imaging, myocardial perfusion technique. Okay, first pass technique, all those some keywords. If you highlight, definitely you can score good marks under nuclear medicine also. Okay, so musculoskeletal, gastrointestinal, lymphatic, endocrine. So all of these system comes under nuclear medicine. Okay, so very easy if you just section by section if you study, definitely under radiology, though it is combined procedure, you can easily score marks. Okay, so as I said, out of 6, 4 question will be combination. You may have to check cardiovascular CPT procedure and then radiology again. So likewise, 2 combination CPT will be there. If you have a good understanding on radiology, you don't have to lose any marks. Okay, so only the types or definite procedures here to study section by section is take 1 day diagnostic radiology. Maybe within 1 day you can go diagnostic radiology and this ultrasound, and 1 day you can go study radiology guidance up to radiation oncology, and lastly you can keep it a reference as a nuclear medicine. Okay, so all of these sections is important. I mean, the concept which I have orally explained, these concepts are very important, and these are all common profi services. Okay, except radiation oncology, most of the things are profi services. So I hope in this video you got to see or you got to learn a little info about radiologic procedure and the techniques. Okay, so I hope this video helped you bit. So if it really worked for you, then please do subscribe to my channel. Please do share with your medical coding friends. And if you are preparing for CPC exam, either you can join classes, live classes. If you cannot attend live classes, means I can provide all chapter CPT class with a 2 hours duration of recording. And if you're completely new to medical coding, means you can join my complete course. Okay, complete course fees will be 5499 for limited time, and CPC only CPT class you want, then you have to pay 2999. Okay, so you will get material, important questions, regular material, and the classes. Okay, classes for almost 1 month. So I planned for 20 days, but current batch it took me almost 1 month. Okay, still we are continue. Still today I have to discuss pathology part 2. In this class I have to review practice questions. Okay, concept I have explained. Today I have to review the questions. Okay, so it is taking a bit longer because of the interaction involvement. Okay, if there's someone ask some question, then definitely the class the duration will go, it will get increased. Okay, that's all for today, and thank you all. Thank you for watching. We'll plan another video with the uh, you know another important concept.